respiratory system and cardiovascular system work hand in hand. Okay, so we're gonna bring oxygenated blood to the cells of the body, and we're gonna get deoxygenated blood away from the cells of the body. Okay, so failure of either of these two systems is gonna disrupt homeostasis pretty quickly, because the cells are either gonna die from oxygen starvation or CO2 intoxication, okay? Right. And there it is. So again, the respiratory system provides for that gaseous exchange. Cardiovascular system is going to transport those dietary, those atmospheric gases. Okay, and again, failure of either of these is going to disrupt homeostasis fairly quickly. Again, respiration is going to be that exchange, okay, of gases between the atmosphere, right? That's the air, right? The blood and the cells. Okay, so 3 steps. Ventilation is actually breathing. So the lungs do nothing for ventilation. Okay, it's the muscles. Your diaphragm, okay, your intercostal muscles, scalene muscles, pectoralis minor, sternocleidomastoid muscles, and abdominal muscles. Okay, right. So pulmonary respiration, okay, is when the air gets into the lungs. Okay, all the oxygen diffuses out into the blood. As that's happened, all the CO2 is coming out of the blood and going into the lungs. Okay, and then once it's in the blood, okay, all the oxygen in the blood goes into the tissues, cells in tissues, and all the CO2 leaves that. Okay, leaves the cells in the tissues. Okay, so if you know the flow of air into and out of lungs, you're doing incredibly well. Okay, you're gonna know the anatomy. Okay, so respiratory system consists of the nose. You breathe through your nose. Okay, you can breathe through your mouth too. Okay, then it's gonna go into the throat. That air. The throat's called the pharynx. You got 3 parts: nasal pharynx, oral pharynx, and laryngeal pharynx. Okay, so know that the throat is the pharynx. Okay, that's important. Okay, know that the larynx is the voice box. Okay, so that for the test. Okay, the larynx we're going to see is made up of thyroid cartilage, because the thyroid gland is right underneath the larynx. Okay, and it's going to be made up. The larynx is going to be made up of that thyroid cartilage, and we call that thyroid cartilage the Adam's apple. Okay. Then we have the windpipe, which is the trachea, of course, know that. And that's got concentric rings of cartilage, and we call that cricoid cartilage. Then it goes into the bronchi, so the primary, secondary, and tertiary bronchi. They're made up of cartilage lined with epithelial tissue. And then it goes into bronchioles, which is going into the lungs now. So we're getting smaller and smaller. So then go bronchioles, terminal bronchioles, respiratory bronchioles, which are microscopic. We go into alveolar ducts, alveolar sacs, and the individual alveoli. That's where you get the exchange with the oxygen and CO2. So the upper respiratory system consists of the nose and pharynx. So nose and throat. So if you have an upper respiratory tract infection, right, you get a stuffy nose and a sore throat. Lower respiratory tract infection, you could get laryngitis, okay, or bronchitis. Or bronchitis. Okay. Yeah.
What did you say was the larynx?
Larynx is the voice box.
Voice box?
Mm-hmm. Your vocal cords are. Okay. Right. So the respiratory system is like actually a series of tubes. Okay. So again, it goes like this. It goes nose, okay, and mouth too. But pharynx is the throat, larynx is the voice box, trachea is the windpipe. There we go. Primary, secondary, and tertiary bronchi, which is cartilage lined with epithelial tissue. Then we go into bronchioles. Bronchioles are smooth muscles, and they're lined with epithelial tissue. So bronchioles will dilate and constrict, right? So if we're exercising or running or something, right, the bronchioles are going to dilate so more air gets in. So more oxygen gets in the blood, so we can make more ATP. Okay? Right? So it goes bronchioles, terminal bronchioles, and then that's when it goes into the lungs. Then from terminal bronchioles, we go into smaller respiratory bronchioles, then alveolar ducts. So think of alveolar ducts, think of grapes, right? You got a bunch of grapes? Okay, the stems of the grapes, that's the alveolar ducts. Okay, they're hollow, the alveolar ducts. Then they go into alveolar sacs, right? So coming off the stem, you got a bunch of grapes together, right? That's the alveolar sacs, and each individual grape is the alveoli, okay? The alveoli is made up of simple squamous epithelial tissue, okay? And what's around those are those capillaries, okay? Those pulmonary capillaries. So all the CO2 Okay, it's in your blood, it's gonna diffuse into those alveoli, okay? And then you exhale, it's like squeezing a balloon, all the CO2 goes out with the air. Okay, next deep breath, all the oxygen in the alveoli now is gonna diffuse out into the blood, okay? Right? So the branch of science that deals with the ears, nose, and throat is called otorhinolaryngology, okay, or ENT, ear, nose, and throat. It's a lot cheaper to put on the door ENT than otorhinolaryngology, right? Because they charge you by the letter.
How much is each word?
It's economics on that. You good?
Yeah.
All right, so here's a picture. So we can breathe through our nose, we can breathe through our mouth. So we have our nasal pharynx right here, right? The whole thoracic nasal pharynx, oral pharynx right in the mouth, and laryngeal pharynx right here. So here's your larynx or voice box made up of thyroid cartilage, trachea or windpipe, concentric rings of cricoid cartilage, and it's going to branch into the bronchi. So this is primary bronchospasm, secondary and tertiary. The right lung's got 3 lobes, upper, middle, and lower. Left lung has 2 lobes, upper and lower, but you got that cardiac notch in there. That's where the heart sits. Okay. So I don't know if I told you. So this guy from vaping and smoking, he got a severe lung pathology, and he lost both his lungs. So they're waiting for a lung transplant. So what they did was, in order to stabilize the heart, because there's no lung there, they put double D implants, breast implants in, and that held the heart until they had them all hooked up with wires and stuff, so you could get oxygenated blood through the heart and all. They kind of like invented this as they were going. They had to have cosmetic surgeons come in to show that the surgeons had to put them in, and they did, and the guy lived, and until they got him a double lung transplant. And thank you. And as soon as the bad lungs came out, because he was crashing, he was going to die. As soon as the bad lungs came out, antibiotics would work, like almost immediately, he started getting better. So he has to stay in Chicago for about a year. He's got to keep going back to get checked and all. But he said he's probably going to do really, really well. And the guy said, he goes, a word of advice to everybody: don't put anything in your lungs. That was his advice. Don't put anything in your lungs except air. Yeah, so pretty cool. If you want to see the article I have, it's on my desk. Okay, this is a really dried out specimen right here. It's a diaphragm. Was that a mummy? I don't know. All right, so the nose, right, it's going to be lined with mucous membranes and cilia. If anything you breathe in, the mucus will catch, and that cilia will catch also. Okay, so it's going to be formed by the frontal bone, the nasal bone, and the maxilla. I'll show you right here in a little bit. Okay, so we have those nasal concha or turbinates in the nose, right? It's part of the ethmoid bone. When you breathe in, it swirls the air. Okay, so it's going to give the air a chance to warm up, and any dust or debris that might be in that air, the mucus and the hairs will catch. The hairs will catch. Okay. It receives olfactory stimulation. That's sense of smell from cranial nerve 1, right? The olfactory nerve. Okay. And it's a large resonating chamber to modify speech and sounds. So a lot of times singers, they won't get their nose fixed or nose job because they fear that it might change the pitch of their voice. That's why Barbra Streisand never got her nose fixed. Okay, so we have the nasal cavity is going to be divided in 2, okay, by a nasal septum or perpendicular plate due to that. Okay, and the anterior portion is called the vestibule. Yeah, the vestibule. All right. So rhinoplasty is a nose job. Okay, so this can either be for functional reasons. You have a deviated septum. Okay, you have deviated septum. You may not be breathing properly. You might snore at night and all. Okay. And what they'll do is they'll break the nose and fix it, and it'll fix the cartilage too. And for cosmetic reasons, if you don't like the way your nose looks, they'll take a break in it, and then they can reform it also. Okay. Okay. So this here, insurance will pay for. This here, insurance will not pay for. But if you have a deviated septum, they'll ask you, "Do you like the way your nose looks?" And if you say no, they're gonna break it anyway. So they'll fix it to whatever way you want. Okay. Hey, how come our nose can't be 12 inches long? Because then it'd be a foot, get it? Think about it. About an hour to get it. Okay, so right here, huh? That's terrible. So here we got the nasal septum. the septal cartilage and the alar cartilage here, and look, dense fibers connected to your adipose tissue. This is what they'll reshape, Okay, so paranasal sinuses, okay, you got a frontal sinus, right, your forehead, venous sinus, and back your eyes, ethmoid sinus, okay, by your nose, and maxillary sinus. So these are resonating chambers, right, those bones are very, very thin. So right here, like, be a frontal sinus, there's gonna be a sphenoid sinus, ethmoid sinus right here. And you can't see it too, but and maxillary sinus. So if you get like face pain, or like eye pain, or headache pain, probably not your head, probably an inflamed sinus, okay? Right here, you can see the nasal concha or turbinates, right? In your nasal cavity, oral cavity. And this whole thing here is gonna be the pharynx, okay? In the pharynx, the lower portion here, my laryngopharynx, I have an epiglottis. The epiglottis is a flap that flaps over the trachea every time you swallow. That could be food, drink, or even saliva, okay? In here also, you got a hole or orifice. This is for your eustachian tubes or auditory tubes. This is gonna drain the fluid in your ears. And when you're an infant, these tubes are horizontal. That's why infants get a lot of earaches, okay? But as you grow, they tip, so it'll drain, okay? If you get a lot of earaches as an infant, okay, they'll put tubes in your ears, and it'll drain it. Once you grow and you don't need tubes, the body just rejects the tubes. The kid will be like, it's sitting in my ear, and the little tube will come out, okay? Let's see, that's good. Okay, so again, right, very important. Okay, what is the pharynx? It is the throat, okay? 3 parts, nasal pharynx, right, equal to the nose, parallel to the nose, oral pharynx, by the mouth, and laryngopharynx by the larynx, okay? So the nasopharynx works in respiration, okay, where the laryngopharynx and oropharynx, you can put food through there and also passageway for air. Okay, so you can bypass a blockage, okay, if you're choking with the tubes, go right up past it, or they can intubate you too. Okay, and it's just where it is. Okay, so very important, right? The larynx is the voice box. Very important, right? Larynx is the voice box. Okay, connects to the pharynx and the trachea. Pharynx and trachea. Okay, so it's important. So the thyroid. The larynx is made up of thyroid cartilage. Okay, it's the thyroid gland is right underneath it. So it's made up of thyroid cartilage. We call that thyroid cartilage the Adam's apple. Everybody has an Adam's apple. Males are just more prominent because their voices are low. Okay, it makes the voice clear. Okay. If the trachea is made up of cricoid cartilage. Okay, I'll show you a picture. This here's the larynx made up of thyroid cartilage. Here's the thyroid gland, and you have concentric rings. It's posterior of cricoid cartilage. This is your windpipe or your trachea. Okay, so the thyroid gland is a big gland, right? And back of there, you got 4 little glands here. Okay, this is the parathyroid gland. Okay, we'll do that next semester. Okay, so the larynx contains true vocal cords. Okay, so if the vocal cords are tight and they're taut, it's going to give you a high-pitched sound. If they're loose, it's going to give you a low-pitched sound. Okay, this gives us recognizable speech. So you can tell who somebody is. It's just on the phone. Okay, if you don't look at voice string. Okay, so here it is right here, right? This when it's open. It's a laryngoscope. So they'll look at things if they think it's a problem with your larynx, right? And if you talk, it opens and closes. It opens and closes. Opens and closes. So you sing. Okay, and again, this is a really dry specimen here. Look at that thing. Ugh. Okay. So, like to keep stuff real life. Okay. So laryngitis is inflammation of the larynx. It can be caused by irritants. Okay, smoking is probably number 1. Okay, or overuse. Okay, it can cause like hoarseness. Okay, it happens to all professors and stuff at the end of the semester because we talk for a living. Okay, when I go home, I really don't talk too much, which is great because my wife doesn't want me to talk. She just wants me to listen. It's like I dropped my friggin' kids to the Jonas Brothers concert last night. Okay. And because my daughter has this thing in her brain that when I say don't order tickets, she still orders tickets. And she orders too many tickets to the amount of seats that are in the friggin' car. Okay? The last concert we went to, I had to rent a truck. I rented a Suburban. Well, my wife rented it, I just drove it. Okay? So now I'm pissed off 2 nights ago, okay, at my daughter for doing this. Okay? So I said, okay, I'll friggin' drive. So I get home yesterday, all the friends are in the house, all I want to do is eat. So I go in the bedroom and I eat and I doze off. My wife comes in and she's like this about what? Goodbye. Goodbye. I gotta go drive these kids tonight. So I did. They're telling me, oh, the concert ends at 10. Yeah, bullshit. Okay, 10. It closed at 11. Ended at 11, which means it never ends at 11. Okay, by the time they finally got to the car, it was about 11:30. By the time I got out of the actual parking lot, it was 12:15. By the time I got home, it was like 1 o'clock. Yeah, 1 o'clock. Yeah. And then my kids are like all excited, and they're like talking about. I'm like, shut the f up! I gotta get up at 6. Yeah. So, yeah. But I guess they had a good time. I don't know. I sat in the car, but I did get a lot of my reading done. I had a bunch of books that were on, so I finished one, got 100 pages in another one, and got a chapter out of another one. So I did get a lot of reading. A lot of fun reading. So I did get that shit done. Yeah. All right. All right. So, so cancer in the larynx is mostly exclusively to people who smoke. Okay, and smokers. Okay. And again, like you ever see people that are chronic smokers, they go like this, right? They got that raspy ass voice, right? My wife's aunt, her Aunt Jane was her godmother, and this lady, I've never seen anybody smoke like she did. She didn't drive. She was a back heart accident at one time, and she was a driver. So we go up to Massachusetts. I took her out my driveway, take her shopping and shit. 'Cause I'm the kind of guy I am. But she go, take me to Tommy's. Tommy's was a convenience store, and she'd buy 3 packs of Marys and smoke them at my wife's grandmother's house, one after the other. Yeah, she would just jump start. She light one match, she just jumps on, right? Her face is very, very wrinkly and dry, and she talked like this. She's about this big. She died of pancreatic cancer. Pancreatic cancer runs in families. If it doesn't run in your family, how do you get it? Smoking. No more cause, smoking. Yeah. She thought she got a bad piece of turkey Thanksgiving, right? Started throwing up. She died right after New Year's. That's how fast pancreatic cancer will get you. Yeah. She was in her 80s, though. But she smoked since the age of 12. She was in her 80s. That's a lot of cigarettes. Her hands were all yellow from it and all. Yeah. And she coughed a lot. So the reason why you get the smoker's cough is, remember, right, ciliate pseudostratified columnar epithelium, right, ciliated. So all the mucus, the goblet cells will catch the irritants, right, any dust or stuff, and the little hairs will bring that mucus up into the throat. So you swallow it, and stomach acid will take care of it, or you spit it out. So the nicotine in the cigarettes actually paralyzes those hairs. That's where the smoker's cough comes from, okay, because your diaphragm's trying to keep all that debris out. Keep that debris up, okay? She'd be packing up a lung and saying it was the air in the town. I'm like, no, it's the cigarettes going in your lungs. We'll go. Okay, so look, this lady was so funny. This lady hated Irish people. I'm half Irish, mostly Irish. So it was funny. So her ex-husband was Irish. They never got divorced. They got separated. And they were separated for like 60 years. And he was a bus driver. And if the bus picked her, like she had to go to work. If he was driving the bus, when she was gonna get on it, she would not get on the bus. That's how much she hated him. And she'd be late for work and risk losing her job. She didn't care. When he died, she goes to the IRS office and says, my husband died. And they go, well, you get his pension. That's how that works. So you get the pension. And they were not legally divorced. On paper, they were still married. And they go, oh, so sorry for your loss. And anytime she met, she spit. She spit. And she goes, that son of a bitch, we were separated for like almost 70 years. They go, oh, in the state of Massachusetts, that means you're legally divorced. You get no pension. And she goes, I don't want his money. Despite herself. Yeah, she looked like almost poverty stricken, and she had a nice pension. It's crazy, right? That's a stubborn woman right there. Yeah. And at his funeral, because she had a kid, she wore orange. No, what? Yeah, she wore orange, because if you wear like orange on St. Patrick's Day, that's supposed to be a derogatory thing. She wore orange to his funeral. That's a mean-ass snake of a woman. She likes me, She didn't like Irish people. She goes, Irish, I hate the Irish, but I like you. But thank you. Thank you, Aunt Jane. And Irish, because you guy was Irish. All right. So tracheas and windpipe know that, okay? So it's got cilia, right? It's got a pseudostratified cilia and columnar epithelium, okay? Okay, 2 methods of bypassing an obstruction. Okay, you can either do a tracheostomy, which right over here, you got that little indentation. you can cut into that. There's not a lot of cartilage there, it really doesn't bleed that much. Or you can intubate someone, let me go back. Intubation is a device where it goes in, it's got like a little, almost like a spoon, pushes the tongue out of the way and you get a tube down in there. Okay, and a person can breathe normally then. You're not gonna be able to talk, but they can breathe. Okay. Good. Whoops, did I pass it? Yeah, okay, so now we go right from the trachea into the bronchi. So we got primary, secondary, and tertiary bronchi. So it goes primary, secondary, and tertiary, okay? The walls of bronchi are made up of rings of cartilage, okay, with the lined with epithelial tissue. The bronchioles are made up of smooth muscle. They are also lined with epithelial tissue, okay? But they're gonna dilate, get larger, and constrict as we need oxygen. Okay, so people with asthma, they have a problem with this, dilate, okay, dilate, okay? All right, so here we come, right? We got, so you have the throat, pharynx, larynx, trachea, primary bronchi, secondary, and tertiary. So you see here with the little like, the cartilage rings here, and then we go into the bronchioles. So we have the first the terminal bronchioles, then we go microscopic into respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. So you can follow the schematic right here. Okay. Okay, so again, the lungs, we have two lungs. Okay, the right lung, we have superior, middle, and inferior lobe. On the left side, we have superior and inferior, but we have a cardiac notch here. Okay, on the right side, right, they're separated. Okay, they're going to be separated here by but here we're going to separate these lobes by horizontal fissure, oblique, and an oblique on this side. Okay, it's there somewhere for you. Okay, so the lungs are going to be surrounded by pleura. Okay, so pleura sacs. So remember, right, the thoracic cavity, right, has three cavities. Pericardial sac here, which we should look at, right here, right, pericardium, and a right and left pleura. Okay, in there is fluid. Okay, and that fluid here, every time you breathe, okay, the lungs will rub. Okay, if you have an infection in there, okay, it's called dry pleurisy. Every time you take a deep breath, you go. And you can hear it on the stethoscope pretty easy. Okay, so you know there's an infection there. Okay, the outer parts, right, it's going to be connective tissue, right, and the inner line is going to be parietal pleura, and then the visceral portion is very, very lubricated. That's going to be touching on the muscle. Okay. Okay. So the pleural cavity secretes lubricating fluid, so it doesn't rub. Okay. When you take a deep breath, the lungs fill that whole thoracic cavity, goes above the clavicles and all the way down to the ribs. And you take a deep breath, they come back up, or the air comes out. Okay, right? So again, in the right lung, you have two fissures. Right, horizontal or oblique. Left lung, you just have an oblique fissure. Okay, that's a horizontal fissure, oblique fissure here. In the middle of the lungs, okay, you have a hilus. It's an indentation. The hilus you're going to also have in the kidneys. Okay, what goes in there is going to be our blood supply. Okay, so we have a bronchial artery, a bronchial vein going in. Okay, and you're also going to have your lymphatics. Okay, and your nerve supply. Lymphatics and nerve supply. Okay, so bronchial arteries, they come right off the lung. So you get the descending aorta. Right and left bronchial arteries are going to bring oxygenated blood to the lung tissue. Okay, pulmonaries are just for pulmonary circulation. Okay, they're going to reoxygenate the blood. Okay, those are pulmonary arteries and veins. Bronchial is part of systemic circulation. Okay, so those bronchial arteries, arterioles, capillaries. Okay, and then venules, veins back out. Okay. Let's see. So each bronchopulmonary segment, right, contains lobules, and this is going to have our lymphatics, arterioles, venules, terminal bronchioles. Now we get microscopic, respiratory bronchioles. Alveolar ducts are the stems of the grapes. Alveolar sacs, bunch of grapes together, and then the individual alveoli. Okay. All right. So we're coming here now, right? So the air is coming down. This is my terminal bronchioles into my respiratory bronchioles. into my alveolar ducts. They look like stems, right, for grapes. Bunch of grapes together, okay, are the alveolar sacs, and each individual grape, okay, is the alveoli. So coming from the heart, right, you have deoxygenated blood. So it's gonna be right and left pulmonary arteries going away from the heart to the lungs. Then it goes pulmonary arterioles into pulmonary capillaries. So, right, the blues means that it's CO2 blood, so CO2 blood comes right here from the pulmonary arteriole into the capillaries. So all the CO2, right, in those capillaries is gonna go into the alveoli. Okay, when you exhale, the alveoli wanna assume the smallest diameter possible, so it's like squeezing a balloon. So all that air leaves, and all the CO2 goes out with it. Next deep breath, all the air comes back in, all the oxygen in the alveoli is gonna diffuse out into the pulmonary capillaries, okay? It's gonna be going into the venules, then pulmonary veins, back to the left side of the heart, back to the left side of the heart, okay? And look at this here, it's elastic connective tissue, then you breathe, right? Stretches and recoils back, okay? All right, so we have different types of cells that make up the alveoli. So we have simple squamous epithelial cells, so pulmonary epithelial tissue, simple squamous epithelial tissue, right? Flat cells, rapid diffusion, oxygen's leaving, CO2's going in, okay? These are called type 1 alveolar cells. Type 2 alveolar cells are also called septal cells. These guys secrete surfactant, it's a phospholipid. So what happens here, every time you exhale, those alveoli want to assume the smallest diameter, so they just squeeze together. Okay, so they don't stick together and you don't collapse the lung. That's what that surfactant does. Okay, it allows the lungs not to collapse every time you exhale. Okay, this is one of the last things that's formed right before you're born. One of the last things that's formed right before you're born is surfactants, what you make. So premature babies have to be on a ventilator because they don't make surfactant. Okay, so they give them a steroid or something. They start to grow and they start making surfactant, then they can get off the ventilator. Okay, you also have alveolar macrophages. Alveolar macrophages, these are called dust cells. These are gonna clean up any debris, anything real small that could get to your lungs, okay? So we used to have a good video. It's called Internal Defenses, and I don't know, we redid the library, I think it got thrown out. But they show a picture of an alveolar macrophage attaching to an asbestos fiber. Okay, someone breathes in asbestos and body's trying to fight it. Unfortunately, you can't, you can't. Okay? That's a bad picture, let me show you a better picture here. Okay, so right here, okay, again, they're not gonna, the lobby's gonna be cut, so it's a slight smear here. Give us 1,000 times normal vision. But this would be an alveolus, alveolus. Okay, and these guys here, okay, these are all simple squamous epithelium here. The larger ones, like here, these are the septal cells. Here, it's a septal cell, okay? And this here would be a dust cell right here. It's another dust cell, okay? So if you're looking at this here, okay, this is my alveolus here, right? So all the air is gonna be in here. These are the capillaries. So again, look, the red blood cells are just about fit to the capillaries. So if I blew this up here, right, when I take a deep breath, all the air is gonna come in here, okay? The oxygen in the air is gonna diffuse out of the alveolus into the capillaries, and it's gonna attach to the red blood cells. Red blood cells can take that oxygen to the other cells. Okay, as that's happening, those red blood cells are gonna be giving off or releasing the carbon dioxide into the alveolus, and then it's gonna leave for the next exhalation, okay? Okay, so the lungs have a double blood supply, right? So pulmonary circulation is gonna be the pulmonary arteries and pulmonary veins. Okay, but we have to bring oxygen to the lung tissue and get rid of CO2 from the lung tissue. That's where the bronchial arteries and veins come in. Okay, just like the heart, right? We have cardiac circulation, that's the blood going through the chambers. But we have to oxygenate those tissues. So the right and left coronary arteries bring oxygenated blood to the heart tissue, okay? The coronary sinus takes the oxygenated blood away from the heart tissue, okay? Right? Okay, so pulmonary ventilation, right? That's the exchange, okay? CO2 is leaving, when you exhale, O2 comes in, okay? All right, so I'm just gonna paraphrase this. So, inspiration, air's gonna come in, okay? So in order for that to happen, so the lungs have nothing to do with breathing, okay, it's all the muscles. So, when you wanna inhale, the diaphragm's gonna contract down, okay? And think, I